Welcome, everyone. Thank you for joining us for today's webinar. My name is Michelle Zapata, and I'm the Program Coordinator at Waterford Place Cancer Resource Center. Waterford Place, for anyone impacted by a cancer diagnosis, Waterford Place provides programs and services free of charge that support whole person care. Today, we are presenting Overcoming Anxiety During COVID-19, presented by Dr. Sumita Bhatia and Audrey Stoppel. Dr. Bhatia is a board-certified radiation oncologist who completed her training at the Mayo Clinic. She has been in practice for over 8 years and is currently on staff at Rush Copley Medical Center. She has a keen interest in integrative medicine and is a scholarship recipient of the Andrew Weil Center for Integrative Medicine. She has been doing mindfulness-based stress reduction techniques for quite some time and has an interest in nutritional and emotional well-being. Audrey is a nationally certified oncology and radiation therapy nurse with 12 years of experience. She is currently a radiation oncology nurse at Rush Copley's Cancer Center. In addition, she has a passion for holistic nursing, in which she is currently taking graduate courses towards a certification. Thank you both so much for joining us today.
Thank you so much for that wonderful introduction. And I'm also so grateful to be able to have this platform to talk to you guys about something that's very important, which is overcoming anxiety during COVID-19. And I think it's really important to address anxiety during this time because we are in a very rare situation in our lives right now amidst a pandemic. And with that, there's so much uncertainty that comes up. And with uncertainty, there's a lot of fear and anxiety. So you take the uncertainty of the pandemic and COVID-19, and then you add that to the uncertainty of what's happening in being a human in your daily lives. Maybe there's some upsetting news that you've received. Maybe there's a cancer diagnosis. Maybe there's uncertainty about your treatment. And maybe there are some changes in family dynamics or changes in your job situation. Also, related to COVID-19. And so, as I was saying, the uncertainty brings up a lot of fear and anxiety, and a lot of it is the fear of the unknown. And so our talk here is to help you navigate during these times and to use these tools and realize that you have the power in you to help you overcome some of the anxiety issues that are starting to come up and just basically to be able to live a happier life. And of course, if you are on some sort of medication for anxiety, you should definitely discuss that with your doctor before, stopping any medication, or, if the anxiety is affecting your day-to-day life, you should definitely bring that up to your physician. However, I really hope that at the end of this talk, you'll find that this will be kind of an experience and you can use some of these tools, not only during this time period, but just in life, going forward. And so with that, I want this talk to kind of be more of an experience than an actual lecture didactic. So try to find a comfortable place, if you're sitting, and maybe let's just start by taking a few deep breaths together just to kind of set the tone of the talk. And if you want to take notes, I encourage that. If you have a journal nearby, or you can even take notes on your iPhone if you want, because there might be some information that you find interesting that you can use for later on. So let's close our eyes, put our feet on the ground, take a big deep breath in, and exhale. One more time, and exhale. Try to let go of anything in your mind that you're holding on to, and try to kind of focus on your breath and focus on the present moment. So with that said, we'll get started on our talk. So what exactly is anxiety? So anxiety can feel like a worry. It truly starts off as a concern. Then it turns into a worry, and then eventually it can actually escalate into a fear. And a lot of times what happens is patients and us in general start living in this state of anxiety, and it starts changing the way we do things. It starts affecting us physiologically. So anxiety can have medical manifestations, such as problems breathing, fast heart rate, and if you're having a panic attack, sometimes even feeling dizzy. And what's important to know is that there is a center in your brain called the amygdala, which is actually related to fear, and anxiety and fear are very closely related to your amygdala. Now, the amygdala, not all fear is bad. For example, if you're in the kitchen, you don't want to touch a hot stove, or you're walking down a dark alley, your amygdala, your brain, your senses are going to be enhanced to help protect you. However, what happens is when you start living in anxiety in your daily life and you start living in that fear-based mode in your daily life. So during the talk, you're going to see a lot of just beautiful pictures of guided imagery to help kind of bring you into the present moment and create some feelings of relaxation. This is a picture, and all of these are pictures that Audrey and I took at some point in our lives. This is a picture from Ojai, California. So what are emotions? Emotions are just that. They're just emotions. So sometimes what happens is, an emotion will come in and then it'll feel very overwhelming, whether it's fear, being sad. And it's important to know that these emotions are fleeting, that they're not permanent. And just like, waves crash on an ocean, we have changing emotions that come and go. And it's part of the human experience. Emotions are part of being human. And life is precious. What happens is when these emotions start to take over your daily life and then affect you physiologically, and you're making decisions from this state of anxiety and emotions, and that's where hopefully this, this talk will help. So it is important, as I was saying, these emotions are fleeting and impermanent. And what can help is when you're feeling an emotion that is uncomfortable, such as anxiety or fear, or even feeling kind of sad, a lot of times we want to just have a distraction and just kind of push away. Sometimes it's helpful to just like put your hand on your chest, breathe into that emotion and see what it feels like, and just declare what it is. Like, I don't feel great right now, or feeling kind of anxious right now, and realizing that these are impermanent and they come and go. And also that you're not alone. Having emotions is part of the human condition. What happens a lot when people are experiencing anxiety is they think it's like your brain will think you'll feel overwhelmed. And sometimes you'll feel like I am the only one. And then sometimes you'll want to isolate. And so it's important to know that you're not alone. And it's a very big part of the human condition. So let's look at some of these words and see how each of these words make you feel. Pleasure, pain, gain, loss, praise, blame, fame, disgrace. What emotion do each of these words evoke in you? And what makes you feel better? And this is a quote that I really like too. Everything you've ever wanted is on the other side of fear. So let's talk about sort of the physiology of our nervous system, the autonomic nervous system. And so the autonomic nervous system, it's basically divided into two parts. And it has a huge play in our emotions. It has a huge play in our physiology, a huge play in our heart rate, breathing, everything. As you can see, you see the brain on both of these pictures, and you see all of these organs, they're innervated by the autonomic nervous system. The autonomic nervous system, I like to describe it as there's two gears. There's the sympathetic nervous system, and then there's a parasympathetic nervous system, and each of these has a role. The sympathetic nervous system is our fight or flight response, and it is the nervous system which was given to us evolutionary wise, and just it's in us to help us in a situation where we need to sort of mobilize for something. For example, you're going to a meeting, and your sympathetic nervous system, you're going to be preparing for the meeting. You're running a marathon, your sympathetic nervous system is activated. Or you're walking down a dark alley, and your senses are heightened to make sure that you're going to protect yourself. So your sympathetic nervous system is kind of like your adrenaline, and it increases your heart rate, releases a lot of chemicals, stimulates different aspects of your body. And then there's the parasympathetic nervous system, which is known as the rest and digest. So this nervous system is taking place a lot at night when we're sleeping, and also when we're relaxed. And each of these have a very important role. So digestion is through the parasympathetic nervous system. All of the the restorative chemicals and hormones that are being released, at night and during the day are also through our parasympathetic nervous system. And the parasympathetic nervous system slows your breath down, slows your heart rate down. So both of them have a role. And you can think of it like, I like to think of them as two gears. Like you go reverse and you go into drive. You cannot be in two gears at once. Just like your car can't be in two gears at once, your nervous system cannot be in two gears at once. And each of these nervous systems, it plays a very significant role as, in our human body on a day-to-day basis. So what you want to do is you want to actually balance your sympathetic nervous and your parasympathetic nervous system, your rest and digest and fight or flight. You want to have a nice balance, a nice homeostasis. And what typically happens with day-to-day life is it ends up being like this. The stress response, the sympathetic nervous system ends up being the main dominant one. And the parasympathetic, which is rest and digest, ends up playing a smaller role. So if you look at like a typical day, wake up in the morning, you have to go to work, your alarm goes off, activates your sympathetic nervous system. Have a cup of coffee, activates your sympathetic nervous system. You go into work, emails, phone calls, information, news, you're stimulated, sympathetic nervous system. Then you come home, and many people, have families that, they're busy taking care of. So a lot of times you tend to be in this like stress, constant sympathetic nervous system. And what happens is if you're too much in this stress response, and a lot of times what happens is when you're in this stress response, instead of like trying to relax and be in the parasympathetic, people will kind of reach for things like you're getting tired because you're not sleeping enough. Instead of giving yourself rest, you'll drink more coffee, or you'll do something, you'll watch something on the news, and that news will actually end up being stimulating. Right now you turn the news on, there's coronavirus, there's this, there's that, and what happens is when you're living in that stress mode all the time, it has a lot of manifestations on your body. The other thing is when you're living in stress mode and an actual stressor comes into your life, like the news of a cancer diagnosis, or just some upsetting news, because your cup is so full with stress, there's not a lot of room, for this life event to take place and to be processed. So I always like to say it's nice to live life instead of your cup full with your sympathetic, try to keep your cup like 2/3 full, leave room for milk where you can have a little bit of extra cushion in your life. And so with that said, what happens when we're living in our sympathetic nervous system and it's overloaded? It looks kind of like this. So if you look at this picture of this guy, gosh, he's got so many things going on in his mind. Anxiety, taxes. I mean, taxes are coming up anyways, deadlines, mortgage, stress. So he's living in this mode, and it ends up looking something like this. You're in fight or flight, and he's constantly running, go, go, go. Your nervous system is constantly being stimulated, and there's no time for it to rest and to actually go into the parasympathetic. And what happens is if you're living like that on a regular basis, there's a lot of harmful effects on the body. So fatigue, breathlessness, headaches, frequent infections. So your nervous system, if in parasympathetic mode, it actually suppresses your immune system. Sorry, in sympathetic mode, suppresses your immune system. Parasympathetic, where you're relaxed, rest and digest, improves your immune system. So if you're living in stress mode, when your body is stressed out, you're more likely to get infections, lower immune system. Also, there's loss of confidence, irritability, depression, anxiety, changes in behavior, accident prone, drinking more, insomnia, restlessness, smoking more. And then there's also a lot of changes in the mind, impaired judgment, negativity, hasty decisions. And I'm not saying, all of us sort of have, when we're in stress mode, we all fall on some level of this spectrum. And when we're living in this mode, we're making life decisions from this mode, which basically creates your life. So my philosophy is if we can change the mode that we're living in, change our physiology, we can actually change our lives, because then the decisions you will make will be different and maybe more fruitful. So what are ways that you can kind of get out of this stress mode and get out of the anxiety, and that can help you stay happy? So we're going to focus on 3 things specifically in this talk, but I do want to talk a little bit about some of these other things, such as good sleep. I cannot emphasize enough how important sleep is. I recently had a patient, and she was having a hard time. She was actually very fatigued, difficulty sleeping, and said that certain over-the-counter medications weren't working. And when I started talking to her, she was sleeping for less than 5 hours a night. She was going to sleep at 11 at night and waking up at 3 in the morning for work, or 4 in the morning. And I said, we don't need to give you medications. We have to change your lifestyle. So getting good sleep is extremely important. There's actually strong data that shows getting less than 5 hours of sleep is associated with a lower immune system and a 350% chance of getting a cold. And coronavirus is essentially a cold. So especially during this time when we're in the midst of pandemic and our nervous systems are already frazzled, it's very important to get good sleep. And this is actually truthfully something I can do a whole talk on, just how to create sleep habits and things like that. But a common thing to do is just to really give yourself, make sure you set aside hours to sleep, avoid looking at your iPhone, TV, anything with blue light, a couple of hours before you go to bed. And sometimes relaxing teas such as lavender, which we'll talk a little bit about in the talk, can help a lot. Good nutrition, very important. I can do a whole new talk about that too. Exercise, social support is very important too. That can definitely help with anxiety and stress. And then mind-body resources. We're going to specifically talk about deep breathing, aromatherapy, and then how to stimulate a relaxation response. And why do mind-body resources work? Because these tools are actually pathways to put your body into the rest and digest mode. And it decreases the activation of the fight or flight mode. So think of it this way, your car can only be in 2 gears at once, right? It can't be in drive and reverse. So you're going drive, 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 drive. Now you take 1 minute out of your day where you use a mind-body resource, a mind-body tool. And for even that 1 minute, you're able to then change the gear to reverse. You already changed just a little bit. All it takes is a little bit of changes to make big changes. So even if it's just like a couple minutes out of the day that you're able to incorporate some of this in your life, it can have big changes moving forward because it can't be in 2 gears at once. And what happens is with time, your brain then starts to get conditioned and go to this other gear. Because right now, it's like the way I like to describe it within the brain is think of snow and you have a track in your brain. Like you have a track in the snow. You've been walking down this path day after day, and this is the way that you've been living life. And now you just switch gears a little bit and you create a new path. Eventually what's going to happen is your brain is going to be able to switch back and forth, and you're going to have more of that balance where you're going to be on the seesaw. You won't be so much in your stress mode. You'll actually be more in a balanced mode. And that will really help with some of the anxiety and some of the stressors and the physiology as well. So before we go any further, how do you feel? How does your body feel? Is there any discomfort in your body? What does the discomfort feel like? Is there peace in your body? What area of your body feels good? Sometimes your back may have pain, but your hand or your arm may actually feel comfortable and good. What does that feel like? Where do you look for strength? Where do you look for comfort? So the first thing we'll talk about is nature walks. So let's go for a walk outside. Now, I found this very fascinating. So starting in March, we were experiencing a lockdown, and there was a lot of, areas that we could go to, restaurants, everything was closed down. And so yet nature was all around us. We were in spring and now we're in summer. And so I started to go for walks outside, which I hadn't done routinely. And I noticed I was a lot happier. I was a lot more calm. And I did a lot of research into this. Andrew Weil Center for Integrative Medicine also has a lot of information about this too. But there are a lot of therapeutic benefits to walking in nature, just specifically in nature, being around trees and animals and plants and so forth, as opposed to the city. And walking in general is very therapeutic and very beneficial for the body. The American Cancer Society actually recommends 150 minutes a week of moderate intensity exercise, which could be a brisk walk, or 75 minutes of moderate to heavy exercise where your heart rate is up, or like high intensity training. So not only is there an exercise benefit of walking, but there's also other physiological benefits of walking as well. So, we're going to just look at some beautiful pictures of nature. I think this is a picture of a tree that Audrey had taken, and this is a beautiful rainbow that was captured. It's just so amazing that these things are all around us and naturally occurring, and sometimes we take it for granted. So nature walks, the term was actually coined in Japan, and it's also known as forest bathing or shirin yoku. And the reason why it was started in Japan is in the 1980s, they actually started using nature walks as preventative medicine. So just like a physician would write you a prescription for medication or, recommendations in their note, they would actually prescribe patients a nature walk, like on a prescription pad. And what they did is, so a lot of the studies on nature walks come from Japan. And Japan is very big on preventative health as well. And what they did is they looked at immune systems for patients, and they looked at the immune system before and after and noticed an improvement in the immune system. This I found fascinating. There actually was an improvement in what's called the NK cell, which is actually a cell. It's like an immune system cell, which helps fight viruses. And they noticed the NK cells before going on a nature walk and after going on a nature walk, and the levels were increased. They also noticed better emotional well-being. So different types of neurohormones were increased after doing a nature walk in the nature walk group. Less stress hormones were seen in the nature walk. And humans have an inner biological attraction to nature. Think about when you go outside or when you go on vacation, you're in nature, you feel great. You go to a spa, they're playing nature sounds. When you think of guided imagery or visualization, they don't show like a construction site, right? They don't show a train or a car. They show guided imagery of nature, waves crashing on an ocean. So it has a very big brain and very big brain connection. These are some pictures actually from Malibu during a sunset. So why is nature so therapeutic? So as we were talking about, there was a study which was done. They looked at 625 patients, and they looked at forest therapy versus urban walking. Forest therapy was consisting of 90 minutes in nature, and this was not just once, it was over time, over several weeks, versus 90 minutes in urban walking. And they noticed there was an improvement in cardiovascular health, decreased feelings of hostility, anxiety, and depression. And also one study actually used this as a way to do cognitive behavioral therapy. And looked at blood markers for stress, known as cortisol, which is like your fight or flight, like your stress hormone. And they saw that there was a decrease in cortisol from doing nature walks. And the benefit was seen literally within 5 to 7 minutes. So your nervous system being out in nature responds very well. You start getting out of your sympathetic, get into your parasympathetic, get into your rest and digest, start to calm down. The other thing which I found very fascinating is, so they've objectively measured this with blood levels now, look at the cortisol. They've also measured it with your immune function, the NK cells. And then the last bit of evidence, which I found, very fascinating, is they actually did MRIs on patients. So they did a brain MRI on a patient before and after, several nature walks. And what was fascinating is the area of your brain that is involved with obsession and worrying, known as rumination, it was dialed down in the patients who were doing nature walks. So people who were doing nature walks actually were worrying less, ruminating less, perseverating less. And I found this so fascinating that something as simple as a nature walk can create such a magnitude of changes in the body physiologically. At the same time, I'm not surprised, because we know that there is a big connection between, your senses and your brain. So if you look at something that's very relaxing and pleasant, it connects to your brain and releases certain emotions, So you walk in nature, you see things which are beautiful and relaxing. And so there's a sight response. There's sounds which are really relaxing. So that also stimulates like a relaxation response. And then there's smells. And we know that your nose, there's a really strong nose-brain connection through the limbic system, which I'll show in just a little bit. So even sometimes the smell of nature, like after it rains, the way that grass smells. So there's a lot of benefits, and this is something that we can take advantage of right now. This picture is actually not too far from Aurora. It's a nature walk near Naperville. So another tool is aromatherapy. So Audrey is going to actually go into more detail about this. What exactly is aromatherapy? So aromatherapy involves the use of essential oils from plants for therapeutic benefit. It's usually inhaled. And this is where I'm talking about, like, if you smell something, that smell, you have a nose-brain connection. And because you have a nose-brain connection, pleasant smells trigger pleasant emotions. So this is why, you may smell something and maybe something from your childhood you didn't like, and then it triggers a response, triggers an emotion. You may smell something that's very pleasant, like bread baking, or muffins, or cookies, or certain scents which are very relaxing, and then it triggers certain emotions. You trigger certain emotions, you actually are in a different physiological state, and you're in your rest and digest. You're not in that drive sympathetic gear. So you're literally changing your physiology just by what you surround yourself with. So this is the nose-brain connection. So the smell goes into your nose. You have what's called an olfactory bulb. The olfactory bulb is actually connected to what's called the limbic system in your brain. And I'm not going to get into the details and make it too complicated. But basically, in essence, you smell something, it connects to your brain, and then your brain starts releasing chemicals and neurotransmitters and emotions that can be pleasant depending on what you smelled. And so this is called the nose-brain connection. And I'm not surprised that our mind is connected to everything else in our body. So it's like the nose-mind connection. And there's actually been a lot of studies on this. So there was a big meta-analysis that looked at 12 studies for the use of aromatherapy for pain management. And these studies had more than 1,000 patients. And they noticed that aromatherapy had a huge benefit in pain reduction and for both acute and chronic pain, and also for postoperative pain, and also decreased anxiety levels. So just what you smelled had a big difference. Now, there's different types of aromatherapy. There's different types of herbs that can evoke different responses. One that I'm going to talk about in great detail is actually lavender. And the reason why is because lavender has over 400 randomized controlled trials on it, well done studies showing that there's a big benefit with lavender and anxiety. Now, some of these studies used oral lavender, some of them used a more potent form of lavender, and some of them used aromatherapy. So the data is a little bit mixed. But the way that it works is lavender, the flower lavender, has something called a nervine, which actually acts on the central nervous system, especially the limbic system, which is our emotional center. And it's essentially an anti-anxiety herb. And that's why lavender can also be used to help you sleep. So if you're having difficulty sleeping, lavender tea can be very helpful. And I recommend you can trying to just get the actual lavender, dried plant itself, and you just steep it in hot water, and you have a cup, and it works very well. And it's not as strong as melatonin, definitely not as strong as over the counter, but it can just be a very gentle way to help you relax, and you can sip on it throughout the day. So there have been a lot of studies on lavender. Now, I said some of these studies also incorporated oral lavender as well. So one study looked at over 15 well-done trials. So a well-done trial is actually a randomized controlled trial. And that just means that they're looking at it's very objective, it's probably one of the cleanest ways to do a study. And they looked at the role of lavender for anxiety and stress with over 1,500 patients. And 7 of these studies noted an improvement in anxiety and stress in at least one measure. And it helps they noticed an improvement in sleep and depression and anxiety. And what I found was really fascinating. Now, this is with oral lavender. There was a study that actually looked at oral lavender compared to Ativan. Ativan is it's a strong medication. We use it quite a bit. And they used it, actually looking at it, to replace Ativan for generalized anxiety disorder and for post-traumatic stress disorder and restlessness. And they actually had positive results. So, the studies are pretty fascinating on lavender. Now, aromatherapy lavender is not going to be as potent, obviously, as oral lavender. Oral lavender is not readily available. You should obtain it from either an integrative physician or, an herbalist. But the benefits of aromatherapy mimic what is seen in some of the oral lavender studies. And some of these studies, as I mentioned, also use aromatherapy as well. So with that said, I'm going to now turn this talk over to Audrey, and she's going to tell us a lot more about lavender aromatherapy.
So Dr. Bhatia, described ways that this anxiety can impact our body. And this is actually a photo that I found on one of my nature walks with my kids. And my daughter says, "Mommy, look there's a stump. It looks just like a heart." And, it was in the springtime when COVID was ramping up and we were getting out in nature just to kind of reset. And it just reminded me that we need to take time for self-care and being aware of how our body feels and any signs of tension or anxiety that we may have. You know, in a time that there is so much lack of control over situation and uncertainty, we actually have the power within us, and we will give you the tools, whether it's through nature or what we'll be talking about with aromatherapy and deep breathing techniques, to kind of change these negative feelings and anxiety into something more powerful and to control these feelings. So we're going to give you those tools today. So why is this important? Again, we are surrounded by a lack of control of our situation, whether it's the pandemic, whether it's your cancer journey, or, you know, with each step of the way within this life that we're living, as people are gearing up to, you know, schools opening, whether they are or not, if jobs are opening, are we going to have jobs later, things like that. All these things that are extra stressors really impact us. But again, we have the power to control our feelings and thoughts with the use of our own bodies and the benefits of nature and use of lavender. So these aren't really hard technical things that we have to do to kind of help reset our mind and recenter us. It's things that are very easy that we can do even in our own home. So if you are unable to get out in nature, you know, using guided imagery, thinking of places that were relaxing and calm, like we showed photos of our journeys, you know, thinking of places that really brought you to a place of peace and calmness in your life, you can use those. Again, if you can't get out or don't feel comfortable getting out and, you know, being and nature paths and things. Using aromatherapy with deep breathing will really help you to really get control of your anxiety. So there are many oils that can help with anxiety and stress, but lavender is one that Dr. Bhatia showed you through so many studies have had so many benefits with stress reduction and anxiety, and it really is a hero in the world of essential oils. It's been used for thousands of years, and the Romans used it frequently, looking back in history. And lavender oil, it's readily available, and the way that it works in the body is very different. What's the natural essential oil versus kind of the artificial chemically made ones that sometimes we find in lotions and candles. They don't have the same chemical components as an essential oil does. Essential oil, the size of the particle can actually pass through the blood-brain barrier. And we kind of saw with the, you know, the olfactory bulb and how it goes to the limbic system. It's very unique. One thing I want to let you know, if you are new to aromatherapy and essential oils, it's very important to get something that is quality and purity tested. You can see now it's becoming a lot more common and mainstream to see lavender oils at the grocery stores and things like that. But you want to make sure that you get it from a place that is trustworthy and has been tested for purity to make sure you get the full benefits, and also it's safe for use. So places you can get that are natural food stores around here, like Whole Foods or Fruitful Yield. They do have organic lavender oils available online, but again, you want to check for the purity and quality test. They're all also direct sellers in the area as well that have consultants that you can get it from. But over the years, I've learned with experience that these essential oils really can transform the way that it's made my body feel, my kids' bodies, you know, times where we're in stress or, you know, overcoming pain and things like that. They really are powerful tools, and I treat them like medicine for my kids. So I have my medicine cabinet and then my oil cabinet, and they know that these are very special oils to use that can benefit us. Oops. Oh, here. I think Dr. Bhatia, you're muted. Okay.
It's okay.
So how is a lavender essential oil made? So it's actually grown in multiple areas throughout the world. And the oil is extracted right on site where it's harvested from. You use the flower like Dr. Bhatia talked about, and actually even the stem and leaf when it is a steam distilled essential oil. And after it's extracted, during that distillation process, it creates that floral and light aroma that, you know, brings us to a place of calm and helps us to kind of relieve some of the stressful and anxious feelings that we may have within. Now, some people say, you know what, I'm not a big lavender fan, but there are so many oils out there. Again, we're focusing on lavender today. In your experience and research, you may find one like frankincense is another great grounding oil with a lot of research out there about how it can help with stress and anxiety. So how does it work? So there is a component in lavender called linalool. So when you break down, just like when you were to break down medications and see how they work within the body, linalool is something that is in lavender that it actually promotes calmness within the body and relaxation. And it will help support several body systems. Again, activating that parasympathetic nervous system and decreasing the parasympathetic nervous system activation in our body. We can use using aromatherapy to get us there. It promotes that restful sleep, like Dr. Bhatia talked about, and easing feelings of tension and irritability. It even helps with headaches, which is another manifestation of stress. And it helps to increase our ability to cope with stress, which is really important during these times. So ways to use aromatherapy. I have my bottle here of lavender. You can even just take the cap off and just kind of smell it directly from the bottle. There's different diffusing jewelry. So I actually have this bracelet that has a little pad in there, and I drop the oils in there. So I can carry my aromatherapy lavender or whatever blend I want throughout the day. So I can do some deep breathing and just to kind of reset my feelings, or just, you know, sometimes, again, these floral scents of the oils are just really relaxing and uplifting. You can also use a diffuser. So I have a diffuser in my background. A diffuser is a great way to adjust the potency of the essential oil. So if you're going through treatment or you have sensitivities to smell, using a diffuser, you can actually adjust the strength of the smell. So if you want a more potent smell, adding more of the oil. And diffusers are becoming more readily available as we're seeing more natural ways, that they're incorporating into our everyday life. So that's something that is great. You can put it in any room of the home. It's safe. There's no flame associated with it. There's no heat associated with it. So these are just some great ways that you can use aromatherapy. Now, there's other uses of oils, whether it's topically or ingested. But again, we're just talking about the power of inhaling these oils to help us during times of stress and anxiety, or getting teas that have lavender in it are wonderful ways to kind of use the power of nature around us.
So thank you, Audrey, for all of that information. I wanted to actually also add a little bit more about the essential oils. So sometimes, you know, what I'll have patients do is, actually I've had a few patients, it was actually my patient's idea. So when they would come in for daily radiation, we would set them up a certain way, and they would, you know, be in a bag and their arms would be up or whatnot. And sometimes they would just put a little bit of essential oil. Now, a lot of times you have to mix the essential oil with regular oil too, or with, you know, so it's not too concentrated. They would just put a little bit on their arms, or even a certain part of their body. So maybe when they're having their radiation treatment, if their arms are up, they're actually smelling something that's relaxing. Or, or just, at least, or they could have the bottle with them and they could smell it with them. And sometimes actually I have essential oils in my office, and sometimes what I'll do is, there's a really busy day and I'm in the, in my stress response, which, while it's very important to help me function, if I want to, if I want to just, it's important to also take a break. So I'll even just, smell an essential oil and just do some deep breathing for a couple of minutes. And that can just, even for 1 minute, it changes your gear, and then the phone starts ringing and, you're busy again. But even just for a couple of minutes, you've been able to sort of switch that gear in your brain. So we've now talked about 2 mind-body tools. One of them, Nature Walk, which is available to all of us. And as Audrey brought up a very good point, if you're not able to walk in nature, if you don't have that accessible, even looking at pictures, you can reflect back on this talk, or even, look at relaxing pictures. That guided imagery has a big impact. So that's the first one. The second one is aromatherapy, basically smelling things which are relaxing, the lavender especially. And the last mind-body tool that I want to talk about is very important. It's actually deep breathing. And now deep breathing can be sometimes a little bit difficult to learn how to do it properly. So I've created some videos that you can look back on. And sometimes from the videos, you may still be confused. I've had some patients where I've, sat there and I've taught them how to do the deep belly breathing. And I've also taught friends as well. And so it takes practice, so just be patient. And if you are more curious about it, you can even YouTube deep belly breathing and you'll see a bunch of videos on it. So before we go into breathing, let's just close our eyes, take a deep breath in, and let it out. One more time. Take a deep breath in and focus on the present moment. I find these next few lines very powerful. So when you're in a situation and you're feeling anxious or overwhelmed, sometimes just focusing on the present can be so important and vital to get you out of that moment. Because what anxiety is you're actually not in the present. You're worrying about something in the past, or you're worrying about something that's going to happen in the future. Sometimes it is your present situation. Sometimes it's, okay, I'm in danger right now, but very rarely it is that. Normally it's news, something you received, or, some stress that you're having. So just kind of focusing on where you are in the present can really help you realize what exactly is happening in your life. And that's called living in the present. So sometimes just taking a deep breath and realizing, I am alive, despite whatever is happening right now. I am alive. Life is precious. I'm breathing. I am enough as I am. I am here and now. So let's talk about deep breathing, the power of our lungs. So this picture is the human body. And what is this magnificent pink fluorescent looking organ? This is actually our diaphragm. Our diaphragm is literally the largest muscle that we have for breathing, but we don't often use it. It's interesting. When a baby is first born, their first few breaths are actually deep breathing. And when we do deep breathing, we actually get more oxygenation into our lungs, and we actually are able to use our lungs to their full capacity. But what happens is we get conditioned to breathe from our chest. So we're constantly just breathing like this from our chests. And when you're breathing from your chest, you're actually using your intercostal muscles, which actually lie between the ribs. So your chests expand and contract. You're not even using this diaphragm. So what diaphragmatic breathing does is that actually, I'm not going to get too much into the details of the physiology, but your diaphragm is a muscle. When you take a big, deep belly breath in, your diaphragm contracts. And what it does is it actually takes these lung bases, the bases of the lung, and it opens up the bottom of the lungs. And then you exhale and it pushes all that air out. So it is literally like the best muscle for breathing. And we don't use it that often. And truthfully, when I started learning about this, I was so fascinated at the power of diaphragmatic breathing and how little it's utilized. And so I started incorporating it into my own life and saw a lot of physiological benefits. Sometimes, I'd be commuting back to work and I'd be sitting in traffic. And I'm just sitting in traffic, right? I am alive. I am breathing. I am here and now. But yet it's just, just you're sitting in traffic. I hate traffic. And I was like, wow, I am having a full-on sympathetic response right now. I am in my fight or flight mode. I'm like waiting to, am I really going to save that extra minute by, weaving in and out of traffic? And I'm from LA, so I can be a little bit of a rough driver. And so I started doing diaphragmatic breathing, and, your mental state changes, your physiology changes. And it's because when we're normally breathing, we're breathing just from our chest. And when we breathe from our chest and we breathe fast breathing is associated with your nervous system, your sympathetic, your fight or flight. And it also activates your amygdala, which is your fear center. So fear, sympathetic, are all activated. You change your breathing, you literally switch your gear. You go from drive to reverse. I'm not saying drive is bad, reverse is good, but just, you're able to switch your gears. So this is a very interesting diaphragm. This is, all physicians have seen this. So this is back from medical physiology. And basically all you have to remember, all you have to look at is this dark red part is our blood flow. So our greatest blood flow in our lungs, the greatest perfusion is actually at the base of our lungs. This is the top of your lung. This is the bottom. The greatest oxygen exchange is actually taking place in the bottom of your lungs. When you are breathing from your chest, normal breathing, you actually are only using zones 1 and zone 2. You're rarely tapping into zone 3. When you do diaphragmatic breathing, because it fully expands the lungs, you're actually tapping into zone 3. And so unless you're doing deep breathing or diaphragmatic breathing or belly breathing, you're not using the greatest portions of your lungs. So think of it this way. Let's say you buy a fancy car and every day you only fill it with 2/3 gas. Why would you operate in life like that? So you would, this is like you want to use your machine, your body as efficiently and as best as possible. And so this is where I was talking about, there's a lung-brain connection. If you're able to get more oxygen into your lungs, you actually slow your breathing down. You're doing less chest breathing, less activation of your sympathetic. You're switching gears. You're going to be more relaxed. And so to talk about how to do diaphragmatic breathing, we have to talk about what is pranayama. So pranayama is a set of breathing techniques. They're related to yoga practices, but they're also part of several meditative practices. And pranayama, basically, it's an old technique it's from the Indian tradition. And what pranayama means is the expansion of vital energy in the human being. Breath is a vehicle for energy. So they're saying breath, oxygen is energy, which makes sense. If you have oxygen, without oxygen, we can't live. Especially during COVID, we need oxygen. We need good oxygen. So breath is your vehicle for energy, and breath is used to access this vital energy. So if you can change your breathing, you can change your oxygenation, you can change your energy state. So pranayama is the rising and expansion of breath. So these are the techniques. So basically, you want it when you inhale, it's best to do it from your nose. You inhale from your nose, your belly should come out. Now, this is very different from how we're used to breathing. And it takes some time to train yourself. And sometimes you may even feel a little lightheaded. So if you do, go slowly at it. And of course, if you have any lung conditions, be very careful with this. However, I'll show you the data around this. There's actually data showing that COPD patients patients with chronic obstructive pulmonary disease, lung problems, were able to walk further after doing, a certain amount of deep belly breathing, the diaphragmatic breathing. So what you want to do is when you inhale, your belly should come out. When you exhale, the belly comes in. And this is and you can still use your chest, but you want your belly to have a big role in the inhalation and exhalation. And this is why sometimes just watching these videos may not be enough, where, like watching them over and over again, practicing, looking at YouTube videos can be very beneficial. So the first most basic way to learn deep belly breathing is actually to be on your belly, like actually in this, what's called a crocodile posture. And I've been doing pranayama breathing for years. I think literally since I was a teenager. So my family is very much involved in pranayama and yoga meditation. And so this was the first thing that I learned, was how to activate your diaphragm, is to actually lie on your belly. And somebody asked me this at a previous talk, why does this activate your diaphragm? Shouldn't it not work? Because how is your belly going to move? Where is the belly going to move? So what happens is when you're in this position, it actually keeps your lungs from moving as much. So that's why it activates your diaphragm. And your diaphragm is moving up and down. And so you can actually activate your belly breathing that way. And I'm going to play this video, but I want to actually bring up a little tidbit as well. So what I also thought was interesting is when COVID first came out, and we heard of all these cases in New York, and especially some hospitals where they didn't have access to ventilators and their resources were scarce, I'm on several physician blogs and groups, for COVID. And there were several physicians that were actually putting their COVID patients in this crocodile posture because the patients would get more oxygenation that way. I mean, obviously does not replace a ventilator, but this was what they were doing to try to get more oxygenation for their patients. And when I learned this in my mind, I was like, well, it makes complete sense because they're actually activating diaphragmatic breathing. And so it has a lot of benefits, the diaphragmatic breathing, the physiology, which I think is often not very, not understood. Sorry, let me go back. So I'm going to go ahead and play this video. You can't really see much motion. You're just going to see that, the patient, the subject is actually just resting, and it's very relaxing. If you are in this position for even 10 deep breaths, you will start to feel relaxed. You might even fall asleep. And if you do, that's okay. That means that your body needed the sleep. So this is another video. Once you've sort of mastered that, or at least practice that, now you can see what it looks like when you're actually lying supine, lying on your back. So just keep an eye on his belly. You're going to see that his breath starts to rise. The belly starts to rise, and then it falls. What was so interesting, so this is actually my brother. He made the video, and I was kind of guiding him through. When he was doing this diaphragmatic breathing, his breath, his respiratory rate, his breathing actually slowed down, because that's what happens when you're breathing and breathing deeper. Your breathing slows down, which is good. You're getting more oxygen. It's a deeper breath. And I actually had to have him speed up his breathing in this video just so I could create a meaningful video. Sorry, let me go on to the. And then this is, hopefully this can be heard. Let's see, and this is where I'm sort of guiding him. Thank you for joining me. So the next type of method of doing diaphragmatic breathing is we're going to do, again, activation of the diaphragm, and we're going to be moving the belly back and forth. We're going to do it in a sitting posture. So first, I'll just have you put one hand on your abdomen and one hand on your chest, and just breathe normally as you normally will. Just normal breathing. And just breathe from your chest right now. And exhale. And now what I'll have you do is I'll have you close your eyes and try to picture, you can continue to breathe normally. When you start doing the diaphragmatic breathing, it helps if you picture a light in your belly or a balloon that's expanding. With each breath, with each inhalation, your abdomen expands, and then with exhalation, it contracts. So, and a lot of times it can help to sort of focus on a phrase. So the phrase that I use is so hum. You can use any phrase that can be relaxing to you and that can help you focus on your breath. So I'll have you take a deep breath in from your belly and exhale. I wanted to actually pause this video for a second because I'm not sure if the sound quality is coming through. So in case it's not, what I'm basically showing in this video is, so to learn diaphragmatic breathing when you're sitting is put one hand on your chest. This way you'll know if you're breathing from your chest. Put one hand on your belly. And it helps to close your eyes. And sometimes it also helps to say a phrase, and like anything which is relaxing. In this video, I used a phrase, it's a Sanskrit phrase called so hum, but you can use om, you can use, 1, 2. And you want to really kind of focus on your breath. So you put one hand on your chest and one hand on the belly. And first, just kind of breathe normally. Just take a few, deep breaths in. And then when you close your eyes, this is after you've sort of gotten used to, the crocodile posture where you're lying on your belly. Now you're trying to do it on your back. Now you're trying to do it sitting up. Is you end up putting the hand on your belly, and then you close your eyes and then take a big deep breath in, have your belly expand. And breathe it out. So you really should be seeing that your belly is moving. And like I said, it's going to take time and it's going to take some practice. So let's talk now about the data behind this, which is so fascinating. So there's 4 studies that showed significant brain findings in patients with slow breathing, which is known as relaxation or diaphragmatic breathing. They actually showed that on the brain MRIs, there was greater brain activity and greater energy and reduced anxiety. And a lot of the studies also noticed that there was an activation of the parasympathetic system because there's a lung-brain connection. So when your body's getting more oxygen, you're going to be happier, you're going to have more energy, there's going to be just so many physiological benefits, cardiovascular, mental benefits and so forth. And then there's another study where they actually looked at patients with COPD, which is chronic obstructive pulmonary disease, like asthma, things like that, emphysema, where after doing this type of breathing, they could actually walk further because they're getting more oxygen in. So in conclusion, changing your breath can change your physiology. Think about like when someone is anxious, why do we say take a deep breath, or like just someone is stressed out, or someone's hyperventilating, take a deep breath. Why during, why is breathing so important? Breathing is how we get oxygen. Oxygen is our life force. It's so important to us. And changing your breath can truly change your physiology. There's increased use of oxygen in the lungs. There's an improvement in well-being. There's a decrease in anxiety and an improvement in cardiovascular health. This is a quote that I really like from one of my mentors, Andrew Weil. The simplest and most powerful technique for protecting your health is absolutely free and literally right under your nose. So with that said, we're going to focus on this slide for just a little bit. This is actually a picture I took on a walk in Naperville. I love the luscious greenery, especially this time of year. And Audrey, with her very soothing voice and energy, is going to lead us in a guided relaxation.
A few more minutes, but we thought it would be great to practice these techniques of deep breathing with you and give you the tools to kind of, anytime you're feeling tension or anxiety, or, with this pandemic or life in general, you're feeling uneasiness, circle back around and think about tools that, again, you have right within you. Your breath, aromatherapy, the nature around you. So we want this to be an experience for you. So one thing I do is I start my day off as soon as I put my feet on the carpet in the morning. I do some belly breathing and deep breaths, and I open up lavender or whatever oil I feel kind of at my bedside that I feel would help with whatever mood I'm waking up in. And I just start my day off right. Again, I'm disrupting that sympathetic nervous system and, getting my cup less than full with stress before I even start the day. So I want you to begin by finding a quiet place to sit or lie down. Again, you are muted. You don't have the video on you. So whatever comfortable position you want to be in. Again, if you're laying down by the computer or sitting in your chair, if this is a deep breathing practice for the first time, lying down, like Dr. Bhatia said, may be easier for you. And this is a natural way of breathing. It's just reprogramming our body to use the diaphragmatic breathing. Once you're settled and comfortable, again, place that one hand around your navel and the other one on your chest. Continue to breathe normal and feel the movements of your hand. Being mindful when you're doing your normal breathing, which hand are you feeling moving more? Is it the hand on your chest or the one on your abdomen? If your hand on your chest is moving but not your belly, you're doing those shallow breaths. By learning these belly breathing techniques, you're likely to feel more relaxed, get more oxygen into the body, bring in more positive energy, and breathe out any negative feeling or energy that you may have inside. We're going to activate that parasympathetic nervous system within the power that you have between your own breath and the feeling of your own hands. So what we're going to do, we're going to inhale to a count of 4. We're going to hold that breath for 2, and we're going to exhale as if we're blowing out a straw in our mouth for 6. So on your next breath, we're going to breathe deeply and smoothly. We're going to expand your belly and slowly count to 4 as you inhale. Ready? 1, 2, 3, 4. And exhale. 1, 2, 3, 4, 5, 6. And now as you breathe, breathe normally. Notice what you feel by expanding and extending the time that you're exhaling or breathing out. Encourage your body to relax. Be in the present. Don't think about what you have ahead of you after this talk. Just be in the now. So when you're ready, we're going to try the belly breaths. We're going to do 4 in a row. We're going to inhale 1, 2, 3, 4. Hold. Breathe out 2, 3, 4, 5, 6. Now rest. Allow yourself permission to be kind to yourself. Don't force anything too much. As you practice this more, the easier and more natural it'll be. We're going to breathe in again. 1, 2, 3, 4. Hold. And exhale. 2, 3, 4, 5, 6. Let the warmth of your hand against your belly and chest represent a friendly, caring support. I want you to do the last 2 breaths on your own. Use a pace that feels good for you and notice how you feel. Consider how relaxed you are. If you're less relaxed, don't worry about it too much. You're just starting to learn this new technique. Breathe in the positivity and exhale any negative thoughts. All right, so with your hand on the chest and abdomen, you not only were feeling your deep breathing, you were giving yourself supportive touch, which is almost like a trifecta between aromatherapy and deep breathing. This supportive touch is something that we're lacking in a time right now of social distancing, but is so important to us. And you have that power to release an oxytocin, which is actually released when we're interacting with others, and a healing touch. So that's just another tool that you're incorporating that you can activate the parasympathetic nervous system. So with these simple tools, I want you to feel how you are feeling right now. If you're feeling more relaxed, if you're feeling like you have tools to bring more control into a time of uncertainty, of anxiety and tension, of the unknown. But just know that even though there's lack of control around us, that we have the power to come out of this with peace and positivity within us. So we thank you, and we hope that you've been able to have some tools that we can help you during this time and the times that are ahead of us.
And I wanted to also thank everyone for joining us, and thank Waterford for creating these wonderful programs. And I encourage you to log on to Waterford and look at their website. They have a lot of great virtual programs that are going to be coming out. And this will be posted so you can look at this, in the future, and use the tools around you. Sometimes it may feel like, life is overwhelming. There's so much going on, and what do I do? But even just a small, subtle shift can literally change your physiology for 30 seconds. Changes that gear. You change that gear, you create a pattern. You create a pattern, you can change your life. I truly believe that. So thank you, everyone, and thank you for listening to Audrey and I.